UFCW 21, and the Washington State Nurses Association. So we'll be doing expedited bargaining over the next week. The plan is for us all to meet every day, hash this out, all day if it takes, all week. So, also excitingly, Providence Health Services has withdrawn proposals on paid time off and short-term disability. And the unions have postponed our strike timelines. But we still have significant patient care concerns that need to be addressed for this process to really be resolved. As healthcare workers, we come to work each day with the Swedish motto in mind to improve the health and well-being of each person we serve. But as a registered nurse, and I know the rest of the staff feels the same, we often feel like we're left without the resources to provide that extraordinary care. And it still hasn't gotten any easier for me with 7 years of experience to explain to my patients why it took me 45 minutes to get you to the restroom, why it took me an hour to give you pain medicine when you had a hip fracture, knowing that I neglected you because I was keeping another person alive. I hate having that conversation, and I just want to hold Providence accountable to helping us provide the extraordinary care that we know we are capable of providing. So we, the caregivers, have made contract proposals that would increase staffing to safer levels to improve the quality of care. Not only that, would recruit and retain staff to close the 900 caregiver gap here at Swedish and address the grave workload and safety concerns of healthcare workers at the front line of infection control. And most importantly, create a strong culture of equity and inclusion for both employees and our patients. Now please welcome Kevin Stuckey, President of the Seattle Police Officers Guild, who has joined us today in solidarity. Thank you.
Well, first and foremost, let me say thank you so much for what you do, because I know personally that in my job, if there's ever a time when I'm needed, I know that I have people who will protect me. And protect and serve is a mantra of the police department. It's our motto. But what I've learned is it doesn't just belong to us. It also belongs to the men and women before you here today, because they protect us when we're our most vulnerable, when we're our most hurt, when we're in pain mentally and hurt physically, and when we're just plain scared. They're the people who are going to be there for you. Now, when I was a young man, and I'm not trying not to date myself here, candy bars were a quarter and they were about that big. Today, that same candy bar is about $2.50 and it's about this big. What I'm saying is that we live in a world right now where they want to give you less and charge you more. And here we have a group of people who are so compassionate and committed to giving you more that they're willing to walk off the line to do it for you. How can you not get behind that? These are our people. These are our protectors. It's time for us to take care of the people who take care of us. Thank you so much.
Thank you, Kevin. So please join me in acknowledging Mary Keefe, who stands with us as a Teamster and a member of the Ambulance Drivers Union.
Good morning. My name is Mary Keefe with Teamsters Local 763. I am super proud to stand in solidarity with the hospital workers of SEIU 1199 Northwest and UFCW and all the other workers here this morning. We support you, and we are proud to stand with you.
Thank you, Mary and Teamsters. Next, please welcome Kenny Stewart, President of the Seattle Firefighters Union.
Hi, good morning. My name is Kenny Stewart. I'm president of Seattle Firefighters Union Local 27, and I have some other firefighters from Seattle here with me. We're here this morning representing 1,000 Seattle firefighters to stand with SEIU Healthcare 1199 Northwest in their fight for adequate staffing and a fair contract. As firefighters, we take an oath to protect the public, and we're here this morning to protect the public when they're patients at Swedish-Providence. Seattle firefighters rely on Swedish-Providence to provide emergency care to the patients that we bring. We want our patients to receive the high-quality care at these hospitals, and we know we can count on the members of SEIU to deliver it, but they need adequate staffing to do it. The patient care concerns that these workers are highlighting are real, and they're dangerous. Our brothers and sisters in SEIU have reported a shortage of nurses, nursing assistants, imaging techs, social workers, and environmental service technicians. They care and protect for our loved ones when they are vulnerable. This impacts patient health and safety. I've experienced shenanigans like this. My mother worked at a hospital that had a habit of cutting corners, reducing staffing, not respecting workers, and not putting patients first. They hurt people rather than healing them. Swedish-Providence can do better. A shortage of these critical workers is unacceptable, and Seattle firefighters are watching Swedish-Providence, and we're hopeful that they will do better.
Thank you, Kenny, and the entire crew. Now, please welcome Nicole Grant of MLK Labor.
Brothers and sisters and friends, my name is Nicole Grant, and I'm with MLK Labor representing over 150,000 union workers in King County. Today is about patient care. The community is watching, and unions are watching. We need to see a contract in the next 7 days that makes sure that members in every industry that come for health care get the safe patient care they need. God bless you all, and God bless the workers, patients, and community.
Next, we will be taking your questions. Thank you so much for coming here to join us today in solidarity.